Welcome back, everyone. We've got case number 6 here. It's another case. It's another brain tumor. Today we have a 68-year-old woman presenting with fatigue. It's going to be a little harder on your test because you're not necessarily going to know you're dealing with a brain tumor, so always keep that in mind. Here we have some MR images through the posterior fossa. You have this is a flare here. This is a T1 pre, and this is a T1 post. Just show you another image up a little bit higher. Again, flare, T1 pre, T1 post. Definitely a lesion there. Start thinking about what you might think it is. Here you have a diffusion and an ADC. Maybe that can give you a little bit clue that you're what you might be looking at, what you might not be looking at. Here we have a couple of thin slice T1 post contrast images in the sagittal and coronal plane. Maybe these give you the best idea of what you're looking at. So try to come up with a differential here for this case. I've been a little bit nice here. Your question is what's your top 2 differential considerations? So you don't have to come up with one necessarily. Hopefully on your exam, if you have a multiple choice situation, you're only going to see one of your top 2, so that would be nice. 6b, your question is what additional organ is most likely to be affected in this patient? Again, a little bit of a second order question. You have to think, is this a tumor potentially related to a syndrome? And if so, which of these other organs might be affected? So when you're thinking about these, you want to think about what is your differential diagnosis in an adult for a lesion with a posterior fossa mass that has a cyst with a nodule. There's really 2 main considerations here. One is pilocytic astrocytoma. This is a very common tumor in young adults and teenagers. Hemangioblastoma is your other consideration. So these are your 2 main things you want to think about. This one happens to be a cerebellar hemangioblastoma. This is the most common infratentorial lesion in young adults. These are often associated with von Hippel Lindau, or at least on test situations, people think about von Hippel Lindau. However, a vast majority of them are sporadic, so they're in patients that don't have a history of von Hippel Lindau. Because of that, they're associated with other diseases, pheochromocytoma, renal cell carcinoma, other hemangioblastomas. On your imaging finding, what you're often going to see is you're going to see a cystic lesion in the posterior fossa that has really minimal wall enhancement, but has a mural nodule along the wall. Now, these will often also have flow voids. So on T2 weighted imaging, you may see prominent flow voids. Now, resection of these lesions can be curative. It's not enough to drain the cyst, but if you resect the enhancing component, you can often achieve a cure. Von Hippel Lindau is a syndrome of numerous benign and malignant lesions. The most common ones that you see are renal lesions, renal carcinomas, renal cysts, renal angiomyolipomas, pheochromocytomas, pancreatic and liver cysts, and then what we saw here in this case, CNS hemangioblastoma. Now, these can occur in both the posterior fossa as well as the spine. So always be on the lookout in the spine as well. Approximately 70% of patients with von Hippel Lindau are going to get CNS hemangioblastomas. Here you see the images that we saw in this case. On flare, it's kind of interesting because the cystic portion itself is not suppressing, so it's very iso-intense to the adjacent brain. You see maybe a little glimpse of that nodule there. On post-contrast, you see a little bit of that enhancing nodule showing up there. As you go to your reformatted images, you get a little bit better idea of the cystic nature of this lesion here and a little bit of a notion of that enhancing nodule along the margin. This is a very classic appearance for posterior fossa hemangioblastoma. There you just see that lesion pointed out again. Now, your question was, which additional organ is most likely to be affected? We kind of talked about that in von Hippel Lindau patients. It's going to be the kidneys because these patients get renal cell carcinomas, angiomyolipomas, and cysts. So these are the most common other organ that's associated with von Hippel Lindau syndrome. Thanks to everyone for tuning in for case number 6. Tune back in a couple of days. We're going to have case number 7 in just a few days. Thanks for tuning in, everyone, and learning a little bit more about brain tumors as you get ready for your exams. Hopefully you enjoyed the case. If you did, be sure to like and subscribe to the channel so you get notifications and you can see when our next videos are coming out. Thanks again.